Hi, my name is Blake, and I'll be responding to Quentin's position on the legalization of marijuana as a medical option. Jennifer McKee, on an article called "Druggists Say No to Medical Marijuana," she said that the U.S. Food and Drug Administration states that there is currently no accepted medical use for marijuana. Therefore, marijuana is still considered an illegal drug by the federal government. It should remain in Schedule 1 because the American Medical Association and the U.S. Food and Drug Administration recommend that marijuana be retained in Schedule 1. And also that Congress has had the authority to reschedule marijuana since 1970 and has not done so because they have not found sufficient justification from tons of hearings and testimonies. Also, in 1997, the Institute of Medicine conducted a study on marijuana and did not recommend rescheduling it. As far as its medical use, Bill Frist, a medical doctor, said that he would caution against this due to the lack of consistent, repeatable scientific data available to prove marijuana's medical benefits. There are less dangerous medicines offering the same relief from pain and other medical symptoms. The British Lung Foundation stated that infections of the lung are due to a combination of smoking-related damage to the cells lining the bronchial passage and impairment of the principal immune cells in the small air sacs caused by cannabis. For treating AIDS with marijuana, the Institute of Medicine report said that patients with pre-existing immune deficits due to AIDS should be expected to be vulnerable to serious harm caused by smoking marijuana. That's because cannabis smoking is likely to weaken the immune system. And since AIDS already weakened the immune system, why would you want to weaken it more? The British Lung Foundation also said that 3 to 4 cannabis cigarettes a day are associated with the same evidence of acute and chronic bronchitis and the same degree of damage to the bronchial mucosa as 20 or more tobacco cigarettes a day. For addictiveness of marijuana, those who used medical marijuana were more likely to abuse the drug or be dependent on it than those who did not use it. For Alzheimer's, Helen Phillips, a scientist and journalist at The New Scientist, stated that some compounds in cannabis, including THC and cannabidiol, interfere with a natural signaling system throughout our brains, nerves, and immune system. Even with purified cannabis extracts, changing the amount, time, or place of a dose could produce completely opposite effects on the body. As far as learning, like helping it improve your brain, John Walters says that smoked marijuana damages the brain, heart, lungs, and immune system. It impairs learning and interferes with memory, perception, and judgment. Smoked marijuana contains cancer-causing compounds. He also says that smoked marijuana has been implicated in a high percentage of automobile crashes and workplace accidents. That is because marijuana can impair driving for a day or more after use, and drug-impaired drivers exhibit the same behaviors on the road as drunk drivers. With that, marijuana-impaired drivers will become even more common as dispensaries open with the legalization of medical marijuana. The National Eye Institute says that they supported research studies of marijuana's medical use in 1978. However, none of these studies demonstrated that marijuana could lower IOP, which is intraocular pressure, as effectively as drugs already on the market. And in addition, Some potentially serious side effects were noted, including an increased heart rate and a decrease in blood pressure in studies using smoked marijuana. For vaporizing marijuana, Donald P. Tashkin, a medical doctor at the professor of pulmonary care at the University of California, Los Angeles, stated that the smoke of marijuana, like that of tobacco, consists of a toxic mixture of gases and particles, many of which are known to be harmful to the lung, whereas THC, the primary active ingredient in marijuana, causes modest short-term bronchodilation, expansion of the air passages. Regular marijuana smoking produces a number of long-term pulmonary consequences, including chronic cough and sputum, and histopathological evidence of widespread airway inflammation. As far as abuse of the drug, Mark Anderson, Benjamin Hansen, and Daniel I. Reese stated in an article titled Medical Marijuana Laws and Teen Marijuana Use that federal officials contend that the legalization of medical marijuana encourages teenagers to use marijuana and have targeted dispensaries operating within 1,000 feet of schools, parks, and playgrounds. Petra Ratu said that in an article called Teens and Substance Abuse Programs Use Medical Marijuana Belonging to Others, that adolescents who used marijuana also had more conduct disorder symptoms. She also said that in Colorado, once an individual is approved for medical marijuana usage, they are able to grow a personal supply or purchase different amounts. And that this year, more than a quarter of 17 investigations by Toronto police into medical marijuana operations uncovered evidence of illegal activity. And the excess growth of plants is being diverted to the criminal use as opposed to the medical marijuana use. And Garen Groff in Medical Marijuana Prescriptions Boost Number of Drug DUIs in Mesa says that people are using more prescription medications and it is very easy to abuse them and easy to obtain them even if you don't have a prescription.